Now, some people may wonder, why are we talking about feet and talking to a podiatrist, a doctor of podiatry, on the Keep Leading podcast? And that's because you are different than many physicians. I've unfortunately had to spend a little time in physicians' offices and such because of different family members and caring for people and different parts of my life. And you just have an incredible bedside manner. You take the time to fix the patient and the problem, and you educate your patients. And so I just felt like, wow, I wish there were more physicians like Dr. Moore. So I wanted to interview you from that perspective because you've got something a little extra that allows you to show up as a leader, as a physician. And so that's why I want to talk to you about your view of leadership.
Interestingly, I wouldn't say pushed into a leading and teaching position, but when I came back to Texas, even though I'm from Northern California, this is where the residency program was. It was an easy fit to start teaching the residents. And early on, you're focused on the technique. You're focused in on making sure they get the right blocking and tackling in regards to the team effort, the back table, and then your teaching starts to shift. I say now in my 25th year, it's about leadership. It really is. And I'm not trying to say this because of your show, but teaching is a leadership position where you must transfer that information to your student the best way possible. I believe it's, watching the teacher teach. It's interesting because I know leadership is also about how you perform, how you hold yourself, what message you get across, besides the fact that there's little idiosyncratic things I go through with surgery, which is trying to teach them what to do when things go wrong. So all that bundled up, it's been interesting that teaching is probably transferred into the waiting room, seeing the patient and thinking to myself, if I don't create a patient experience where they see what they have, find out how they can fix it, home remedies, what they do have, right down to the pictures I draw from my surgeries, then I'm doing them a disfavor because there's Google, there's other doctors. They're going to want to know why I'm doing it and why they're having the procedure, so they feel better and they feel more relaxed.
I love how you said you transfer the teaching that you do as a professor into the waiting room. That's brilliant. I love that. And I've experienced that. So I didn't know that was your thought process, but I like that.